All right, folks, we're going to go ahead and get started here. Panelists, are you ready to go? Wonderful. We know we'll have some more folks joining us as we get settled in, but we want to be mindful of your time and thank you all for arriving and joining us today. We're thrilled to have you. Good morning. Thank you for joining us for the launch of the 2024 ALICE report of the Hudson Valley. As a reminder, and this is all written in the chat, the webinar is being recorded. All participants are muted to help manage the audio quality and organize the questions we will receive during this presentation. So we want to ensure that everyone can hear us clearly, and we will address questions at the end of the presentation. You can enter your questions into the chat box as we go along or at the end of the presentation, and we'll go through them in the order in which they're received. The latest ALICE report, links to the website, and any materials will be emailed after the webinar concludes. So you will be able to refer to those resources after this presentation to continue looking at the materials and the data as it serves your purposes. Let's see here. Make sure everyone is connected. I think we're good to go. As we settle in and ensure everyone has successfully connected, we invite you to get us started by participating in a series of questions. So I'm going to invite Faith to go to the next slide here. We have a poll this year. It's a new feature, and we invite you all to participate. It's a great way to build community and show the impact of all of us coming together and utilizing this research and data for different purposes. You can simply screenshot this QR code on your mobile device, and it will come up with a feature that allows you to enter in responses to a few polling questions. This is anonymous, and we will be sharing the responses so you can see who you're gathered with today and understand the folks that are joining us to learn more about the ALICE report and how it serves our individual and collective communities. So we just click there on the QR code. You can also go to slido.com and enter in that code 4046302. So we'll give everyone a few seconds to enter that QR code or that link into your own device and answer some of those questions. You'll see two toggles at the top, Q&A, which is currently not active. That will not be our Q&A feature for this program. Please use the chat, but you'll go to the top of the page that says polls, and that will have the questions. The first being, what industry, field, or are you in? And then you select. You continue to go down through the questions and hit send, and we'll reveal the answers once we have collected responses. After you've submitted your questions, you should see a screen that pops up that says, thank you for your response. That way you will know that everything has been submitted. You do have a question, enter it into the chat, as we're not able to unmute you to listen to any questions, but we're happy to answer your questions through the chat feature. All right, so you can see here we have quite a few folks from the nonprofit arena. And we also have a lot of folks from other fields. I'm sure there may be some not represented here, but we're all community members. So hopefully you are captured in that category. Our numbers are adjusting here. I'm getting some real-time data, so. All right, super. Great. Thank you all for responding to this first question. Whenever you're ready, Faith, to go to the next answers, we'll just keep it going. So this represents expenses that have cost you more over the past year. So it's very interesting to see from all of our different arenas where our focus lies in terms of increased cost and expenses. So this gives you a quick snapshot representing the different responses that came in. Food being a primary source of increased expenses. I think we're all feeling that burden. Great, thanks, Faith. Next question. Oh, that's great. This is my first time too. So for the 52% of you that are joining us today, that's great. You're in good company. It's been a tremendous resource for me to utilize in my new work at United Way. So I'm really thrilled that you're here to glean something from this presentation, but also just from the statistics that we'll be sharing as it applies to your work. So we welcome those first timers. For those that have been repeat audience members, thank you so much for joining us and relying on this presentation. We really appreciate that you value the time and our contributions to this information. So thank you for prioritizing this. Your goal participating today, many of you are change makers where data helps guide our priorities. That's an incredible role, very important role. So thank you for making this a key part of your review and analysis for your implementation of change. All right. Drum roll, please. The answer is 11%. So that is where we are with Hudson Valley's poverty rate. So for those of you who got that correct, congratulations. But also it's a tough number to hear. Poverty is not something that is a goal we've set for ourselves, something we want to eliminate. So it's important to always know where we stand with that, to recognize where our community is situated, and to be able to be responsive to that. Thank you all for participating in that poll. We really felt that that would be a great way to build our community here and understand how we're all participating and coming to the table. We can't lose sight of the humanity and the individual experience that we're all having in our work and in our personal life about how this information relates to us. So a quick introduction. I'm Stephanie Kearns. I'm the new president of the United Way of Ulster County. I'm delighted to welcome you on behalf of my United Way colleagues from throughout the Hudson Valley. If you can all do a quick little wave when I call your name. From the United Way of Dutchess-Orange Region, we're joined by Jeannie Montano, president and CEO, and Melissa Clark, vice president of Community Impact. Welcome you both. From the United Way of Rockland County, Stephen M. Pappas, President and CEO. And finally, from the United Way of Westchester and Putnam, the team that also created all of these materials and the polling. Thank you both for your help with that. We have Tom Gabrielle, President and CEO, and Faith Ann Butcher, Chief Impact Officer. Thank you so much. Together, we are privileged to share with you data from the 2024 ALICE report across our 6 counties. Today's webinar, Alice and the Cross Currents, will feature data from the 2024 ALICE report. Some of the data presented will be from 2022, so it's important to keep that in mind. It is the most recent data available, and in other cases, we've extrapolated data or taken data from other sources. That's typically, for those of you who are new to the statistics realm, that is typically how it goes. Data is collected and reviewed over time to maintain its integrity and its, the timing in which it takes to pull all of that information together. So you'll see that it's really reflective of 2022, but based on trends and information that helps us inform today's current state of things. So just please keep that in mind. The ALICE report is brought to you by the United Way of New York State in partnership with United for ALICE, a driver of innovative research and action around financial hardship for ALICE households. ALICE stands for Asset Limited, Income Constrained, Employed. Next slide. The ALICE report is a critical tool that sheds light on the financial struggles of a significant but often overlooked segment of the population, individuals and families who work yet struggle to make ends meet. The ALICE report serves a few important purposes. It broadens our understanding of poverty. It reveals the true cost of living. It guides policy and advocacy. It promotes community investment. It raises public awareness and supports businesses. And we'll get into more details about that later on in our slide presentation. Just a few couple of quick things. The Alice movement was originally developed by the United Way of Northern New Jersey and has spread to 27 states and the District of Columbia. And the Alice report for New York highlights the challenges that many hardworking families face and serves as an important alert for both policymakers and the public. So what you take away today is extremely important to continue spreading amongst your constituents and colleagues. We currently have today's webinar featuring data from across the Hudson Valley, New York State, and is brought to you by these 4 United Ways. We're all sponsoring this and have come together to prepare information and individual presentations for each of our counties that reflect the Hudson Valley, and we'll all be speaking uniquely about our different areas of locale. Next slide. We'd like to thank these community partners that helped us spread the word about this webinar, and we'll continue to share Alice information with the community. You're all very important to us, and we appreciate you endorsing and supporting the work that we're doing with the Alice report and how it informs all of our work. I'm now going to send it to Tom Gabrielle to review the agenda and keep us moving.
Sure. Thank you, Stephanie. So as you can see from the agenda on your screen, we're going to start with who is Alice, then talk about the year-to-year shift and how much does it cost to survive. Where does Alice live in the Hudson Valley? The demographics of Alice, the Alice Essentials Index, which we'll explain in a little more detail, and of course, how United Ways are helping Alice. And if there's time at the end, which I'm sure there will be, we'll open it up for questions and comments in the chat. Next slide, please. So let's begin with a level set as to who is Alice. So Alice is the group of individuals living and surviving just above the outdated federal poverty level. These are people who work, people with jobs like home health aides, preschool teachers, cashiers, warehouse staff, waiters and waitresses, security guards, bank tellers, and landscapers, just to name a few. These are all people who are essential to our economy, but don't earn enough to live here, whether that's Westchester or Putnam or any of the communities in the Hudson Valley. Next slide, please. Before we delve into the numbers, it's also important to level set some of the terms we're going to be using. So when we talk about households, we're talking about households that consist of people who occupy a housing unit. We are not including those who live in congregate settings such as dorms, nursing homes, or prisons. Household survival budget estimates the bare minimum of costs associated with the basic necessities like housing, childcare, food, etc. And it is adjusted for different counties and household types, including seniors. The Alice threshold is the average income that a household needs to afford these basic necessities. So if you are below the Alice threshold, that is including individuals who are working, but also poverty level households. And the Alice Essential Index is the measure of the average change over time in the cost of the essential goods and the services that households need to live and work in today's economy. Next slide, please. So why did we update the Alice report this year when we just released a report last year? Well, there has been a significant shift in the numbers, which we knew would be the case when we presented the report, the Alice report last year. That's due to a number of factors, including inflation, right there, big center, migration, wage increases, pandemic era assistance going away, and job disruption, or as we like to call mass resignations. Next slide, please. Now I'm going to turn the presentation over to Stephen Pappas.
Thank you, Tom. So as Tom was highlighting in terms of the trends and the changes that we've seen, more households are now below the Alice threshold. You know, he had mentioned it in the key terms, and you can see that in terms of the increase in terms of total number of households that are now Alice, you have 28,347 more families underneath that threshold. Next slide, please. So what does that look like? For this cost and wage comparison, you can see from 21 to 22 that things have gotten more expensive. You look at what the survival budget is, and we'll go into more detail on that later, but you could just see overall that the need for income has actually increased within the Hudson Valley. If you take a look at the one in the middle, which we're going to highlight right here for the 21 to 22, where you look at the 2 full-time workers, the important thing to look here is that there was $15,000 in federal tax credits and stimuluses that families lost. Could you imagine if your boss came into you and said, okay, sorry, Stephen, we're going to cut your salary by $15,000? How would you react to that? And that's what the federal government did to many families within our counties. Next slide, please. The previous slide, we showed that there was a huge gap between the poverty rate and ALICE. This just highlights it even further and looks at it over a 10-year period, even further, actually 12-year period, of the difference between what poverty is based on what the federal government is saying it is and what we know is actually the truth within the Hudson Valley. ALICE is having a huge gap, and this just highlights it without even coming close to each other. Next slide, please. So how much does it really cost to survive in the Hudson Valley? That's really the question. So what I want to highlight here is we did talk about the federal poverty level and the gap, but let's make a even comparison, ALICE numbers to ALICE numbers. So when we're looking at the New York State ALICE household survival budget, and we look at the averages across the state, the Hudson Valley is being outpaced easily. If you look at the family of 4 and you see that 94,000 is what someone needs to be making in a household, and then you look at the Hudson Valley and they need to be making $108,000, that's a huge gap. That's something that when we were looking at those federal stimuluses and those tax credits, and that's the difference there. Next slide, please. So what I'm going to do is I'm going to jump into a little bit on Rockland specific. My colleagues are going to go into each of their individual counties as well after me. But for Rockland, what I want to highlight specifically is rent. If you look at the top level and look at the ALICE household survival budget for a single adult, and $786 is what people say for the statewide that you need to be making or putting towards your rent rather. And then you look at Rockland County and the survival budget is $2,205. It's absolutely crazy that that's what someone has to be putting towards their rent in order to survive. We're not talking about thriving here, we're talking about surviving here. And then when you go down all the way to the bottom and you look at what they need to be making, $52,000 is what people need to be making bare minimum in order to survive in the county. Next, please. Back to Tom.
Thank you, Stephen. So we're going to look at what it costs one adult and one child in childcare. But before we do, part of what's affecting the Hudson Valley and part of what's affecting Westchester County is that poverty has grown significantly in Westchester County. Since 2010, poverty in Westchester has grown by 37%. So that is definitely buttressing. And if you go back to that slide when Stephen was talking about how ALICE has increased and then how poverty has increased, you'll see that those numbers are pretty stark. In Westchester, the situation is grim for a single parent household with one child in childcare. For those households, the ALICE threshold is just under $67,000 a year. That's more than $12,000 higher than the New York State average. And also, as a disclaimer here, some of these costs are conservative estimates, like rent and technology. I don't know about you, but technology costs a heck of a lot more than $86 a month. An important takeaway here is that minimum wage in Westchester is $16 an hour. So it takes an 80-hour work week at minimum, plus tax credits, for a single-headed household with a child in childcare to survive in Westchester County. And actually, if you do the math, they're falling a little short of the 66,864. Next slide, please. And the situation is just as frightening, if not worse, in Putnam County, where a family of 4 with 2 adults and 2 children in childcare must earn $121,000 to fall above the ALICE threshold. That's almost $27,000 more than the New York State average. The biggest cost here for Putnam families is rent and again childcare. Significant numbers speaking to the need for both of those to be addressed in our communities. Next slide, please. So it's back to you, Stephanie.
Thanks so much, Tom. So I'll talk about Ulster County, a family of four, so 2 adults, 2 children. When we review these numbers for Ulster County and look at how dramatically the landscape of Ulster County has changed with the migration of so many different people into our community, we have to think about how they're operating, how they're working within their family to meet all of their needs and more. And the expectations for transportation are what we really hone in on. When we look at the transportation costs alone and just what's expected for a family of four, is that really representative of the transportation needs for working people to and from work? And then that doesn't contemplate the fact that many of us as parents are chauffeuring our kids around to numerous activities and opportunities that they may not otherwise get if they don't have the transportation to get there. Unfortunately, the transportation system is not as helpful as it can be in our area. It's often unreliable, and that makes it extremely difficult for families that may be a one-car household to achieve the needs that they need for their family to give their children the best possible experiences, especially when those experiences are available to them, but they may only, be limited because of transportation. The other numbers represented here also, rent is a huge highlight of the costs in our area, and our housing problem is a big one in Ulster County. We talk about it a lot, and we're in the process of looking at numerous housing solutions in our area for all of those local families that have been outpriced of their previous rental situations. So that number doesn't truly represent the rising costs of rent in our area. Another thing to note in terms of Ulster County is we have many people seeking refuge in our county from their homeland, from other places. And so for those folks, they may not be able to benefit from any tax credits as it applies to their own budget. So that's not truly representative of a cost reduction for the outlay of financial commitment that they have representing their family. Thank you.
Thank you, Stephanie. I'm going to talk a little bit about Dutchess-Orange Region. So first of all, I'm going to speak about a very important population, our local seniors here in Dutchess County. So first of all, if any of you know of an apartment for $870 in any of our communities, please do let us know, because I do not know of any. Something else I'd like to note is that for this Dutchess County senior household, they need to have $40,000 to make that survival budget threshold, and a Social Security average for the individual nationally is about 24,000. So it's very difficult for this population. We'll go to the next slide and look at Orange County. So here you can see similar trends in Orange County for a household of 2 seniors, 65 and over. But I would mention it's actually quite higher than Dutchess County. You're looking at having to have a household earning $62,000. And this is because in Orange County, you have a higher cost of food, healthcare, and taxes, which was very interesting finding. And again, this data is essential to all of the work that we're doing. And obviously, for all of us, it's important to know these trends as we are very involved in the community, nonprofit, government sector, but also for you all when you're looking at applying for funding and things like that. This data is a really excellent resource, and again, really just speaks to the needs in our particular communities. So let's go to the next slide and find out, where does Alice live? So I know that folks are having trouble with the chat box, and I do apologize for that. But if folks want to put in the Q&A section where they think Alice lives, I'd like to see any guesses. I'll just give you one moment to do that. All right, hopefully folks are making some informational guesses right now. Let's go to our next slide. So this may be surprising to a lot of folks, and great, I do see some folks perfect. So you can actually go ahead and just put it in the chat box. That's great. So folks, if you want to, you know, caution a guess of where you think Alice may live. Great. And I see a lot of folks chiming in. So I do appreciate that. It's always great when we can have that conversation back and forth. So this may surprise you. These are the 5 communities in our areas with the highest below Alice threshold. So they are interestingly too in Jeannie and I's region in Dutchess-Orange. So we have Palm Tree, Port Jervis, Newburgh, Poughkeepsie, and Middletown. So for folks that, you know, are on this call that are in our communities, this may or may not surprise you, but for me, I thought it quite interesting that it was mostly in Orange and Dutchess counties. So we'll go to the next slide. So then thinking about the cities now in all of our territories with the largest below Alice threshold population, again, this may or may not surprise you. Lots of you all are in, you know, the research sector. You see these needs every day with the folks that you are serving. So again, may or may not surprise you, but something that was interesting, we found the largest was Yonkers. Then we'll also Ramapo in Rockland County. We also have Mount Vernon in Westchester, New Rochelle in Westchester, and Clarkstown in Rockland County. So again, just something to keep in mind as we are doing the work, as we are finding how best to allocate our resources, programs, and services, thinking about where these folks are. And we'll keep going. Great. So then these are the top 5 communities with the lowest below Alice thresholds. And this does not mean that Alice does not exist here, just that the numbers of the population are lower. So we have in Pound Ridge in Westchester, in Scarsdale in Westchester, Newcastletown in Westchester, Rice City in Westchester, and North Castletown in Westchester. So again, interesting to look at this trend in the county of Westchester. And we'll go to our net. Perfect. So then the top 5 cities with the fewest below Alice threshold population are Denningtown in Ulster County, Pound Ridge Town in Westchester, Kingston Town in Ulster, which I found to be an interesting statistic myself, Greenville Town in Orange County, and Milan Town in Dutchess County. And now I'd love to see, for those of you that hazarded a guess about where you thought that Alice might live, if you guessed every community in the Hudson Valley, then you are correct. So thank you all so much for participating in the chat Q&A, and I'll turn it over to Tom.
Thank you, Melissa. It should come as no surprise to anyone on this webinar that some groups are disproportionately living below the Alice threshold. Those who are more likely to be living in hardship include single-parent households with children, seniors, Black and African-American households, and those least likely include married families with children, 45 to 64-year-olds, and white households. Next slide, please. As these bar graphs show, they're looking at families with children in the Hudson Valley region. The gold section indicates those above the Alice threshold. The light blue and dark blue indicate Alice populations and poverty populations, respectively. So as you see, single female-headed and single male-headed households are disproportionately in comparison to married households below the Alice thresholds. The black bar and its shades of gray represents all households. Next slide, please. These bar graphs look at households by age. Again, the gold section indicates those above the Alice threshold, while the light blue and dark blue indicate Alice and poverty, respectively. And the black bar and shades of gray represent all households. Those households headed by individuals under 25 and those over 65 are at the highest risk of being below the Alice threshold. Next slide, please. And finally, this chart shows the Hudson Valley households by age. As you can see, the gray line represents seniors, and it's been steadily rising in hardship for them since 2010. But the last 5 years have seen steady increases for both the 25 to 44 and 45 to 64 age cohorts. Next slide, please. And these graphs look at how disproportionately Hispanic, Latino, and Latina and Black African American households are living below the ALICE threshold in comparison to white households. So 52% of Black and African American households and 50% of Hispanic, Latino, and Latina households are living below the ALICE threshold in comparison to just 34% of white households. Next slide, please. Stephen, that's all you.
Well, I'll say, kudos to Faith to actually find where money's disappearing. You get paid and then all of a sudden it's gone and nobody knows what happens to it. But Faith magically captured that. So, but in all seriousness though, Alice Essentials, this is where that money disappears. You get paid and you wonder, where does all that money I just made go to? Housing, education, food, transportation, healthcare, your cell phone. These are all things that just eat up your monthly bill. And you're like, wow, did I really work for anything that month? Next slide, please. So when we look at inflation, everyone has the misconception that, some years inflation may go down or whatever the case is. Inflation is always going up, always. And the consumer price index is where the federal government actually analyzes and looks and says, okay, this is what we're going to use as our gauge about what inflation is doing. For us, the Alice Essentials Index, which Tom was mentioning in the key terms, is very important to us because we feel that's a better marker for showing what truly is happening in terms of inflation and where poverty lives. Next slide, please. When you look at this, and you look at the below the ALICE threshold and what we are anticipating, and you look at what these different places, these different job titles are making, you can see that their buying power is going down. The reason being is that when you think about the consumer price index and you think about what that includes, many of you might know what it includes, but it's not just those basic essentials that we were talking about. It's not just food. It's not just transportation. It's not that cell phone. People think those are the basics that are included, but also in the consumer price index are things like going out to restaurants, major appliance purchases, things that maybe the Alice household is unable to do. Mostly, actually, is not able to do. Because when you think of people are getting hand-me-downs. They're taking things, oh, wow, you don't need that? Okay, I'll take that fridge because it's 5 years, 10 years, 20 years better than what I have in my house. Next slide, please. So where's inflation really hitting the Alice population? And what we have here is a comparison between non-Alice and Alice. And what are people doing to try to, save and be able to respond to the issues that we're facing? Some people switch to cheaper, use less, or stop using products. You get a cheaper shampoo, you get a cheaper soap, and you see that's something that a lot of people do in their daily lives. One thing I do want to highlight, though, is where people are having issues is that their rent increased. That's where inflation's really hitting people. The rent increases in Rockland County as a highlight have been humongous. We've seen in health disparity studies that we've done in addition to the Alice project is, double, triple for some households. And that's where inflation is really hitting people hardest. Next slide, please. So what does that mean for policy implications? Social Security, SNAP, Medicaid, pension for veterans. These are all things that, and I'll highlight exactly for SNAP, people that know SNAP know that you have to be within the federal poverty guidelines in order to be qualifying. That huge gap that we were showing before between the Alice line and the federal poverty line is humongous. So you have a hole between those two. And this is where policy is not meeting what is actually happening on the ground. Families that need assistance, that need help, do not qualify because Alice is not considered for assistance, basically. People think that, okay, they're surviving and they don't really know the numbers, and that's why we do this. And that's where they're paying the price. Next slide, please. So what does it really look like to survive and then thrive? Okay. Because in past years, we've talked about survival budget, and that's absolutely key. But what does it mean then to thrive in the counties that we then serve? And this is what it looks like. So if we're looking at a single adult, you can remember that when I was talking about the numbers for a single adult for all the counties for the entire Hudson Valley, the housing rent for a single adult was $1,341. Here you can see that a thriving stability budget is $1,836. And that annual total of what people are needing in order to be stable in our counties is $64,272. Now, mind you, this is an average for all the counties, so each county may vary. And in the ALICE data, when you go into it, you are able to select all the counties, 1 county, 2 counties, 3 counties, whatever, and you can play with the numbers. Because I will tell you, I've done that myself. We're all data geeks on here, and this stuff is stuff that we're very interested in. And you can tell also, look at the difference of what a stability budget looks like for 2 adults, 2 children in childcare. If, to make $183,900 when you have 2 kids is extremely difficult in our counties. And this is the average for every single county. Okay. Next slide, please. So then what we're going to do right now is we're going to talk a little bit about how our United Ways are helping ALICE. Okay. Since I'm already talking, I'll just keep on going. But in terms of what we're doing at the Rockland United Way to help ALICE, we're doing health-related social needs screenings. So when we have our Healthy Spring Valley and Healthy Havistraw programs where we focus on population health, we want to be on the ground helping those ALICE households to find out what's going on in their life. What are the social determinants of health that they're facing, and what kind of services do they need? Tom will go into a little bit about 211, but that's the backbone for that program as well, where referrals need to be made. And how do you know what you need? Because somebody may say, well, we don't have a lot of food, but there might be other issues, other social needs screenings that they are needing that they can't even think about. Because when you're just surviving and not thriving, you really don't necessarily know all the different facets. And that's where the United Way of Rockland County is now branching out and making sure that we provide that service so that we could also help our fellow other nonprofits and saying, hey, these are people that need assistance in this. And then those families know more in order to be able to get those services. Thank you. And Melissa, why don't you go next?
Thank you so much, Stephen. Yeah, so to echo a lot of the great work that we have going on in our communities to help those that are below the ALICE threshold, we also work collaboratively and collectively around 211. I'm not going to steal Tom's thunder, so I won't go too much into that, except that it is available 24/7, 365 in over 200 languages. So such a fantastic resource. We also work closely with our local county around eviction prevention, and again, collectively around that 211 resource. We do provide crisis response funding for folks to ensure that they're able to stay safely and stably housed. Maybe it's a flat tire, maybe it's a utility bill, something like that, that can ensure that that family or household is able to remain financially stable. We, of course, also work on our Cash Coalition, our Free Tax Preparation Coalition, and weirdly, we're going to November, so tax season is around the corner. So folks are able to receive their earned income tax credit or child care tax credit. And again, I'm sure Tom will also speak a little bit about that. That is a fabulous program that's available in several of our local counties. And a huge shout out to Community Action Partnership, Linda, Eddie, Dave Weaving. We have our essential items program out of our basement on 75 Market Street in Poughkeepsie. So you can give a shout out to Rebecca Lull. I give her an email and you can come in for an appointment, select the items that are there to help the family or household you're serving. Maybe it is household items, hygiene items, clothing, bedding, what have you. We're helping lots of under-resourced folks, especially those that may be survivors of domestic violence, maybe foster children, maybe veterans, maybe unhoused. So that's a really vital program that we can provide help with at any point. Of course, what we're known for, our community fund. So we do fund lots of programs and work collaboratively in partnership around health education, financial stability, working around after-school programs, crisis intervention, and food access. So that's a tremendous program. Thank you to all of our funded partners and community partners that are on the call right now, supporting this work and all that you do every day. Like a lot of the United Ways on this call, we also support our emergency food shelter program. So that's another strategy to help folks stay stably housed and remain financially stable. We have wonderful food access programs helping folks get signed up for SNAP benefits in our community. So reach out to us if you are in that position or know folks that may be and may be SNAP eligible. We have transportation programs like some other United Ways here, providing Lyft vouchers to medical appointments, grocery store, food pantry, what have you. We provide volunteers out into our local community to roll up their sleeves and do a lot of this tremendous work. We've just celebrated Make a Difference Day and tons of volunteers out there. So thanks to the team. And a lot of diversity, equity, inclusion, and equity programming is built into all of our programming, and that's very essential to the work that we're doing. And hopefully I didn't talk too long. I'll turn over to Tom, and hopefully I didn't steal too much of your thunder. Thank you.
No worries at all, Melissa, and it's all important stuff to share. Thank you. So here in Westchester and Putnam, pretty much everything we do is focused on giving a hand up to Alice households. As many of you know, there's our 211 helpline, which is free, confidential, as Melissa said, 24/7. Last year, it handled 660,000 interactions, providing information and referrals around basic human needs, or Alice Essentials, depending upon what you want to call it. Our call center doesn't just serve the Westchester and Putnam communities. It also serves the entire Hudson Valley region, as well as all of Long Island and the Adirondacks. And with the most common 211 calls being around food insecurity, housing insecurity, and rental and utility assistance, it's obvious that the Alice report is accurate and that the need of the Alice population is real. There's also our Essential Goods for Basic Needs program, which provides almost $6 million worth of new items, such as mattresses and pillows and bed linens and backpacks and diapers and a host of other things to nonprofit organizations to then give out to their clients and people in need in the community. But another way that we try and lift up the Alice population that's relatively new, it's only a couple of years old now, is through our Education United childcare program. As you saw in Westchester, the average cost of childcare is equal to or greater than rent itself. That's one of the many reasons why we launched the Education United After School program. This free bilingual program serves almost 600 children in 3 high Alice population school districts, Ossining, Greenburgh, and Tarrytown. The program helps these families by enabling them to enroll their children in a free after-school program so that they can earn a few more dollars to pay their bills and ultimately save for the future. But the curriculum being offered through the Education United program also helps close the learning gap that so many children from marginalized and low-income families experience. Because the Education United program is bilingual, it prepares children for future success. And finally, the wraparound services that are offered by our United Way social work and family engagement specialists help families access additional programs and services, not just offered by the United Way, but offered by other nonprofit organizations to make sure that their children are set up to succeed for years to come. So we're not only helping families today, but we're helping their children tomorrow. And I'm going to turn it back over to Stephanie now.
Thanks so much, Tom, and everyone for sharing about your United Ways. A few highlights about United Way of Ulster County. So we have a new team here, and we've been evaluating ways to respond to the community and really support our local neighbors and friends. The first program that we have is our Emergency and Homeless Prevention Fund, which is a key source of financial support for families who need a Band-Aid solution. So Band-Aid is not the permanent solution, but you need a Band-Aid to heal the wound. That's what we say, and that's what we try to focus on about why those funds are so important. So we work with Family of Woodstock and other organizations to identify eligible candidates for those funds to respond to those needs and purposes to help families and individuals who may need that quick solution in real time. We're also focused on the systemic change and improvements in our area to help the underlying issues improve. So as we're looking at those opportunities, we recognize that there are a tremendous amount of nonprofits in our specific county. And so our goal is to work with them to empower their work and to enhance the impact they're having in our community. We're launching a nonprofit incubator, which will help provide business solutions and guides for our brothers and sisters and nonprofit work to help empower their direction forward and continue their mission work, which really does help close the gaps in our county specifically. We also, just like Dutchess-Orange, participate in a tax preparation program that we plan to do again this year, which does definitely help serve a great need, especially for Alice folks who are desperately in need of that support so that they don't have one more thing that could slip them underwater. And the last thing I'll mention that's been key to the way that we've worked in collaboration with our locale is working with the county to be the administrator for the ability to pay youth and specialty education providers for work that they're doing, which they may not otherwise be able to get paid for. So it helps provide additional employment opportunities. It solves a big problem for the county when they're looking to fill positions that are extremely difficult to fill, perhaps from some of these Alice candidates who may be juggling multiple jobs in order to meet a survivable budget. Thank you again, all of you, for sharing about the work of our collective United Ways. We are an extremely strong group of people who are very passionate, and I can tell by many of the comments in the chat that all of you are equally passionate and you're here for a clear reason. I want to ask Faith to go to the next slide. And before I review a little bit more about ways to take action, which many of you I know are already doing, I do want to acknowledge some of the comments in the chat. The first is a reminder that this is reflective of 2022 budget, 2022 statistics. That's important. We understand that that trend has only trended upward, and we share frustrations with all of you about numbers, being really reflective of what we're directly experiencing. Many of you have commented about how rental prices still seem, low. Based on what you're seeing. We agree. We know that there is a tremendous fight for housing options, and in some cases there aren't even options to be had. So sometimes it's not even the pricing, but the availability, and we recognize that. Also, in terms of locale, there are certainly certain areas in which we cannot gather complete statistics that truly represent the communities being served. So in addition to it not representing homes where there's congregate living, we also know there are areas in which there are certain folks that may not be counted in some of the statistics. And that is part of the nonprofit's work, is to see those additional numbers and to recognize those who may not be represented fully. So we completely see that and understand that. I just wanted to make those two notes. I do want to remind you all again about 211 being a critical resource. We invite you to always direct people to that phone number as a way to get answers for many different needs that may come up. It's a great way for someone to just get peace of mind and navigate to the right next step. And then these are the areas in which all of you can, should, and do help to use these numbers and figures to make a real change and to directly impact our response to our friends and neighbors in need. So we really appreciate the work that you do to advocate for affordable housing initiatives, promote access to quality, affordable childcare, to strengthen the workforce development programs available and to add more, to support a livable wage legislation. Please do not sit back on political opportunities to be a voice in the room, whether it's a town hall, even a school board meeting. Go support them, have a voice, and certainly advocate for the work that you all and we all are doing. To expand healthcare access, to encourage investment in transportation solutions, to partner with local employers for family-friendly policies. That's something we're certainly doing with our nonprofit incubator, and we encourage you to review your family-friendly policies in any way that you may be able to influence employer cultural change. To build financial literacy and savings programs, to champion tax credits and benefits awareness, and to promote data-driven policy decisions. And that is, limited. There's an unlimited possibility of the ways that you can help influence. So we really appreciate all of you being here today with us. We thank you for engaging in our work and in this information, and we truly hope that it informs you moving forward about what you're doing to make positive change and directly influence the growth and the strengthening of our individual communities. Thank you to my fellow United Ways and Faith for running the tech for this. We appreciate all of you, and we'll follow up with the information as promised so that you can access this data as needed for your use.
I will quickly just add that several people are asking for our contact information. So I have thrown that in the chat. It looks like Stephen has and Melissa has as well.
Yeah, I would also add that a couple of people did make comments of surprising communities that they were like, oh, wow, this has more than this community, et cetera, et cetera. We also have to remember when you think of Alice and you think of poverty, it's not necessarily just the extreme poverty that you see in certain communities, but it also is just that they're not able to survive. They're one paycheck away from not being able to pay their bills, so that's what the survival budget is as a cap. That doesn't necessarily mean that certain communities, even though there is some wealth, doesn't mean that they're all surviving. They're struggling day to day to day to day. And that's what we want to highlight in terms of this Alice data, to rethink about what people think about when they think of poverty. Alice is what we should be utilizing so that people can actually, make their bills. One of the questions that will actually, so Julian says, can one of the speakers address the importance of expanding SNAP, EFSP, which for those, that's the Emergency Food and Shelter Program, and other affordable food as medicine initiatives. That's what we're talking about. These are people that are not able to make their bills, and they have to decide between, getting their medicine for whatever ails them or actually eating. People shouldn't have to make those decisions, and that's where that cap is coming from.
Another question that was asked in the chat, someone had asked about the rent numbers and where does the data come from? So I know that the United Way of Northern New Jersey is the one that creates the Alice report in partnership with different communities. So the United Way of New York State and several United Ways volunteer as part of a committee to pull that together. But a lot of the data comes from the census and the American Cities Report. Is that what it's called?
Consumers.
American Consumers Report.
I also put a link to the methodology in the chat.
Thank you.
I can only stay quiet for so long.
That's okay.
Takes a village. I'm looking to see if there are any other questions. Yes, Ulster County we are the ones working on launching a nonprofit incubator, and I put my information in the chat. There were some questions about how many nonprofit organizations does United Way help and collaborate with? Countless. I mean, collectively, so many all the time, anytime, right? It's many, many. And if you find an opportunity to work with your local United Way, or if there's a way that we can connect with you, please reach out to the one closest to your locale. We're always looking for more partners and people that we can either help or who can help enable some of our programming to be effective.
And yes, confirming the report, the recording, the data, the PowerPoint, everything will be shared. So you don't have to worry about that. You don't have to do screenshots of the presentation as we were going along.
Just looking, any other question? Ooh, good question. The number of staff manning the 2-on-1 calls. It's a center. It's a real center with a director. And I mean, it's a pretty dynamic operation. And I know they are always looking for updated information and whatever resources they have. They have a whole, complicated system where they're routinely updating the most current information. I don't know the exact count, but I know it's numerous.
It's about 15 or 16 that are working out of our call center in White Plains, which again serves Hudson Valley, Long Island, and Adirondack region. There are 7 call centers throughout New York State serving all 10 regions. We are the only one serving 3 regions. And like I said, right out of here in White Plains. So it's the local staff, local individuals, local people from this community that are answering those calls 24/7.
I'm still getting more questions about that nonprofit incubator. It is a big topic here. And yes, for those that are writing, it is absolutely about limiting the duplicative work and everyone wanting to solve problems in a new way, but rather to strengthen and empower existing nonprofits that are already getting up off their feet. I think all United Ways have our hand on a pulse of what's going on in our communities. And we have many folks come to us to either verify a service or a source or a resource if we're not collaborating or partnering with them. So we're always happy to direct and be a resource and help guide you to someone that can help if we don't serve that exact resource. But yes, the nonprofit incubator is meant to limit and lessen how many more nonprofits are grown, but to focus in on what's working well and how to help them work even better. Oh, great, Melissa. Everyone was asking for your contact information. Thank you for putting it in the chat. So Dutchess-Orange just put email in chat. So check that out there to contact them. This was wonderful. It was certainly a pleasure for my first time. Thank you to all my fellow United Ways for supporting and helping me feel so welcome in this process. It's extremely informative and such a critical key piece of data to help our work. So we appreciate you all taking the time to be here. And thank you all for your service to the community and to one another.
To answer Katrina's question, we do work with libraries. I know in Rockland County, Stephanie, I can't speak for the other regions, but we definitely do work with the libraries. I know many of us do as well in different capacities.
Love libraries.
We work very closely with the Westchester Library System. Terry Kirchner is a member of our 211 policy board. So yes.
And while we're looking for more questions to come through, I will state that every United Way is unique. We make sure to address the gaps that are in our communities. We are local. We are, working as a region here together, but we each, know our communities very well, very, very detailed. So we want to try to address those gaps in a collaborative way.
And yes, updated summary reports will be available for Westchester and Putnam. I believe they're on our website already. I don't want to commit my esteemed colleagues to when or if they have it up, but I'm sure if they're not up already, they will be soon.
Faith is nodding her head, so she's got it covered. Oh, great. We've got some interns here. Social work interns. Stick with it. It's hard work, but stick with it. It's so important. We need you. So I'm glad you're here and you're definitely in the right place. So keep doing that research. Well, I suppose if we don't have any more questions, I guess this is, I mean, I'm loving the beautiful accolades and the celebration of our presentation. It certainly makes us all feel really good about this. We really treasure this time with you and appreciate the privilege to be able to share this with all of you. So we're glad that it was informative and helpful. Thank you all so much.
And I just want to take a quick second and give a round of applause to the newbie on the call, Stephanie. You did a fantastic job. Thank you so much for leading us.
Oh, thank you so much. It was a pleasure. Thanks to all of you.
Yes.
Well, thank you, everyone.
Thank you, everyone.
And thank you.